Welcome to Part of the Solution, because what the world really needed was another podcast, except for this one actually cuts through the noise. Hi, I'm Natalie, your coach, speaker, truth teller, and your favorite no BS friend. Around here, we're talking health, healing, habits, hormones, and how to finally grow a mindset that gets out of your own way. There's no filters, just real conversations that might actually change your life. Okay, welcome back to today's episode. I've got a dear friend of mine in the studio today, Daniele Bugbee or Tarantino?
Well, Tarantino, yeah, I know. Tarantino is my maiden name. This does confuse people. I just love my last name. I had a hard time giving it up. So my name is Tarantino Bugbee legally, actually.
Yes.
So whatever works best for you.
Okay. Yes, I understand that. I love my last name and I'm married now and I haven't changed it and I really don't want to. So when you, especially for you, I feel like your name is, so we're from a small town and I feel like your name is very well known, your last name. And so I feel like, and it's a good one, like it's got some grit.
Good one.
Yeah.
But then, like, when I'm doing stuff with my kids' school, I use Bugbee. So I just confuse the hell out of everyone.
Yeah.
Basically.
Yeah. Welcome to the show. Thank you so much for doing this. Why don't you start by just telling my audience a little bit about what you do and why you're here?
I'm super excited to be here today. I am a nurse injector. I work at a med spa in Petaluma, California. And my role there is administering neuromodulators. So those are things like Botox, Dysport, Jeuveau, Xeomin, Daxxify. I think those are all the FDA approved ones right now. And dermal fillers and biostimulators. There are also lasers at the med spa, but I am just an injector, kind of a unique position.
Yeah. And so why don't we just start right off with what is Botox? What does that do? Why do we all want it? And why is it like crack?
Botox helps to relax muscles. My job with it is to be artful. We can smooth lines, we can prevent lines, I can lift certain areas. It was actually turned into a full face treatment. It used to be this upper face treatment for crow's feet and lines across our forehead and between our brows, but we've really gotten more sophisticated over the last handful of years. We're putting it in necks, we're tightening jaw lines with it, we're relaxing people's mentalis muscle, that little orange peel look that people get here and now. I can flip lips with it. I can change smiles and help people to show more or less teeth. It's just exciting what we can do with it.
Yeah, more like all over like facial balancing or just, I mean, we're never symmetrical, right? I deal with that within my business as well. But it's all about, I think, creating this more aesthetic. And then for me, like what I love about Botox is the glow. So tell me, what is this glow? Why do we have this glow?
I think there's a little more oil control going on, so you get this healthy glow in the forehead. I think that's a good point, what you said. Like, we're never all symmetrical, and symmetry, while it is one of the goals of mine, it can look really weird if you take dermal fillers and try to make someone perfectly symmetrical. I think my goal with neuromodulators or Botox and fillers is harmony. So, like, making sure the transition zones look natural. And then as far as muscle movement goes for Botox and Dysport, it is a teeter-totter what I'm doing. Some muscles I inject depress things. Some muscles I inject elevate things. So I'm always trying to figure out what's that balance. So when this patient is animating or in a conversation with someone or in a photo, something doesn't look off or toxed or unusual.
Yeah, you want it to be like simple and significant, but natural. Like I'm always in my business, I'm always trying to give a natural appearance. I don't want people to look overdone. And I do feel like that is part of what you'd offer is a natural enhancement, not a, oh my gosh, type of look.
That's my goal.
Well, but I'm sure some people do. Do you, I guess when it comes to filler more so than Botox, I mean, are you having to tell people no? Like, what is it? What's going on with that?
I do tell people no a lot. Thankfully, augmenting is kind of going wayside. And what I mean by that is like we are not now putting lips on a face that weren't once there. At least I'm not. We are not building cheekbones that weren't once there. Everything that I'm injecting nowadays with fillers, I'm trying to reestablish something that that patient once had. So we have this complex, like deep fat pad changes and super fat pads are sliding. I try to inject the diminishing fat pads. That's my focus while I'm looking at the patient's face. But yeah, it is hard because sometimes people come in and they see something on social media. Social media is really hard to deal with in my profession. And, it might be somebody that has different approach than you. And so you have to kind of tell them like, I'm not doing that. That comes with confidence. As I get further in my career, I'm just like, you can go see somebody else.
Yeah, yeah,
Yeah.
for sure. No, and I've seen that confidence within you over the years because we kind of got into the beauty world around the same time-ish,
You
and
sure did. It was wild, right?
yeah. And it's crazy just to see the difference. Even as I've been injecting, you've been injecting me since the very beginning. Just even your touch, the way that you do it, what you offer, like your confidence is huge. And I think that that comes from just experience over time and feeling good about Danielle and like what type of practices and what scope she stays in while she's practicing and what she's gonna do. Like, I don't ever see a patient or a client of yours where I'm like, "Oh," like people have their signature look, and yours is definitely like this beautifully natural, enhanced look, never overfilled.
Yeah, that's my goal. So thanks. I appreciate that. But the trend is moving towards that too. So I'm finally in fashion. Yay.
Tell me a little bit about how social media has, like, changed the game in that regard, or influencers or.
I am so busy. I don't catch these reels, or I'm not on TikTok. So I don't, these aren't targeting me, but sometimes a patient will come in and say, I saw this, or they'll show me a video too. It's interesting. It's like treatments that they have kind of self-prescribed themselves that I don't think are appropriate because, they saw somebody's jawline get snatched, with Botox and all these words that they're using. I just have the conversation with them that that's not real, or it's not appropriate for you, or you don't need that, or this is how much that costs. And sometimes that'll be a stop for them too.
What is something like that you like that's trending or that people are asking more? Like, what's your bread and butter? What do you love doing?
I love doing filler, and I think it's kind of being knocked right now because we're seeing all these bad examples of filler. You only know the filler that has been done, right? From those celebrities. And so people come in and they're so scared of filler, but it is so important to revolumize the face because it's a huge part of the aging process. We have deep fat pads diminishing, and you really need to put the volume back in that area to support the more superficial fat pads and the skin structure too. So I love filler, and people call sculpture a filler. That's not a filler. That's a biostimulator. I think in combination, these can be really powerful tool. These collagen stimulators with a little volumization. I think it's the point. Everything with life, right? Like our diets and everything. Like just don't get too carried away with one of these items. Like a little bit of everything kind of gives that harmony that I'm always looking for in my patients.
Do you suggest people to do Sculptra, and what is Sculptra exactly?
Sculpture is a biostimulator. It's been around for a long time. It was brought onto the market to treat lipoatrophy in AIDS patients. So it was brought to help revolumize faces. Now, what we're using it as is collagen stimulator. It's poly L lactic acid. It's what dissolvable sutures are made of. It's derived from beetroots. It's biodegradable, biocompatible. It's placed under the skin with a bunch of water, so it is injected like with needles. It's kind of hard for people to visualize this. And then your body responds to it by building its own collagen network. So you get the fibroblasts. And with collagen comes, you address skin laxity, skin thickness, all the things that are changing. Because what you guys do is you come in and you point to like a shadow down here and like think I can just stick filler in it. And sure, I could stick a filler in the shadow in the lower face, but really it's multiple things that are happening that create that shadow. So it's my approach to actually just put back what you once had as opposed to just chasing lines, which is what we used to do. And that's just, it's what we knew. And this is why continuing education is so important. So important. Reinvesting in yourself.
Yeah. Okay. So let's talk a little bit about that because I know you are on your own journey right now and you're back in school. So let's chat about that.
It is a journey. I am in grad school. I'm getting my master's to be a family nurse practitioner. So, right now, I'm a registered nurse. In the state of California, registered nurses have to work for doctors. There should be something happening called a good faith exam, where one of these providers, it can be an MD, a PA, or an NP, which is what I'm studying to be, assesses the patient that and makes sure that they are physically in good health for the treatments.
Mentally, physically.
Physically in good health, yeah. Well, we should be checking people's mental health, but I think that's coming next.
Especially with filler. Or they need like a mental health exam first.
I really do think that. I mean, sometimes people are going through, we all go through seasons and then we obsess with something. And then and it's my job, I feel like, as a practitioner to say, like, that's not a big deal.
Also, like, how long have you been thinking about this? Was it just 1 week and then you booked an appointment, or have you been thinking about this filler for 3 months or 2 years? Like it's like getting a tattoo. Like it shouldn't just be a spur of the moment thing. It should be like a well thought out process.
Yes, it's like bangs. Have you seen that? Don't
Yeah,
get bangs, get
yeah,
therapy.
exactly. Exactly. So as far as filler, why do you think we went so crazy with the lip filler? Like and the weird thing is like everybody says the same thing, like, "Oh, everybody's overfilled, it looks crazy." Yet so many people are doing it.
Yeah, I mean, again, luckily, I think this trend is reversing. We're seeing a lot, and I'm really happy to see it. A lot of people dissolving their old filler. So I have people coming to me who have received fillers in their early 20s in the lips from multiple injectors all over, and now they're ready to dissolve it because they saw something on social media. So that's social media working in a good way, I guess. It's something called, I think, perception drift. And I think it's hard for a patient when you look at yourself in the mirror every day to realize these changes that have happened to your face, and you keep wanting a little more and you keep wanting that satisfaction and then it's kind of your injector's job to stop that from happening, or for us to keep things balanced. But it's hard as an injector too, because we deal with a certain amount of body dysmorphic disorder, and we have different people in the industry that we may look up to that kind of push these things. So it's hard to keep a clear head a lot. And it's also, sometimes it's hard. Sometimes you have a stubborn patient and it's hard to say no. It's really interesting. That's really a skill that took me a while to develop.
Yeah, the art of saying no and not people pleasing is a very hard one. I definitely deal with telling people no, and I always apologize, and most of the time they thank me for, like, honesty and just not just doing it to do it. Because I always tell them, like, "I would love to take your money." Like, don't get me wrong, like, I miss out on a payday, but I wouldn't want my name associated with that and my morals and my standards, so I just don't think it would look right or, whatever the case may be. You said something earlier. What was that word that you used?
Perception drift,
Yes. What does that mean? Give us the description.
meaning you can't see the changes over time that are happening as we're making these changes to your face. So you have normalized the way you look. So I will just have injectors with the most hideous work dead on say to me, like, they can't believe how overfilled people are, but like they obviously can't see it in themselves. I mean, that is the perfect example of perception drift. So you see it in your patients too. They're going to come to you from other injectors and like ask for this, this. And I'll say, like, I actually want to dissolve. Like, can we start there? I think you would look so much better. But I think patients are just looking at a line, right? You just see a line and you just want it gone. It's hard to really realize the dysmorphia that can happen over time. Luckily, I think in this area, Northern California specifically, I think we have a really great set of injectors with good eyes. We don't prescribe that LA look to everyone that comes into our offices. So we're lucky to have really good injectors in this area.
Yeah, I would agree. I think the only thing I see, and not from you, is lips that are been overfilled, but it's mostly people that are not from around here or come from different areas or, like you said earlier that you want to dissolve it and start over. What is the dissolving process? I didn't even realize you could do that.
We dissolve with Hylenex or Vitrace. What that is it's an enzyme that breaks down the hyaluronic acid. I believe it's also used in hospitals to unclog IVs and stuff, and it will dissolve right on the spot. I inject it in the patient, I massage it, and then I can feel the filler dissolve between my fingers as I'm massaging it. And then they go home, it continues to work, and they come back a week later and I'll fill it back if it's appropriate.
Okay, so somebody comes for that. Like, how often are patients willing to spend that time and money to dissolve it and start all over again?
The cost of dissolving can get pretty pricey. It starts like around 500, but usually you need multiple vials. So it can go up to 1500 and then you're paying to refill. So this is like a thousands of dollars endeavor sometimes. So it really is in everyone's best interest just to go to a conservative injector in the first place, or don't injector hop, or really try to listen if somebody tells you why they don't want to do something for you.
Well, and I think too, like people, yeah, they just want what they want when they want it. They want instant gratification, and that is what filler is. But people, like we were talking about, they're not in reality with it. I feel like you have a great way of putting that out there. Like, I know that I've come in, I've had Botox with you, I've had filler with you. I've come in with an idea of like what I want, and then you and I have this discussion, and by the end of it, it's not completely different, but you've broken it down in a way that I can understand, and you're giving me reasons like why that choice isn't a good idea. Like when I wanted filler here or in my cheekbones. And so I respect that about you, and I think a lot of people do.
Thank you. I appreciate that. I do really truly believe, though, that's part of my job. As nurses, like we are trained, it's ingrained in us, like patient education. And people don't think to carry that over to aesthetics, but I really did. There are a lot of injectors that do that too, because it's our job to educate you why we're prescribing, because we are administering medications to you certain things for certain areas. So thank you. I appreciate that. I try to educate all my patients.
It's going to build trust as well. I trust you completely. I feel like if I go to you and say, do whatever you want, like I'm not going to come out looking insane. I will just come out looking natural, glowy, healthy, all of the things. Speaking of, I want to talk to you about my personal situation because I haven't had Botox or what's the kind that I like?
You like Dysport. I like Dysport.
Dysport.
Yeah.
I haven't had it since I think October because I felt like it wasn't working as well. It wasn't lasting as long, and I wasn't getting like that effect that I wanted. So, can you speak on that a little bit about resistance, or is that a real thing?
Yeah, occasionally you see resistance. It's pretty rare, but you do see it sometimes. You'll see it in patients that get frequent treatments, and I'm talking like within 90 days. I always try to get my patients do not retreat within 90 days because of the emerging evidence about people building antibodies when they do that. There may be, now this is all hypothetical. Like we're trying to figure this all out, because I didn't start seeing resistance until probably 2020, 2021 in people. It could be dosage, like frequent high dosing could contribute to the antibodies that people have. And then also, there's something going past like 7 or 8 treatments, you may develop some antibodies with some of the neuromodulators. So this is science, and we're all still trying to figure it out. I do think sometimes people get caught in these little treatments, and sometimes it just feels better to come get like a complete treatment every 3 to 4 months. And for some of my patients, it's 5 to 6 months, which is good for them. That's the schedule I'm on too. So you're not too. So how long goes October?
It's been 7, 8, almost 9 months. So I'm trying to wait a year It is hard. There are some times where I like catch myself in the natural light and I'm like, oh, that's different, like, so I've wanted to call you many times and just say, fuck it, like, let's book an appointment. Like, I want all of the things. But there's a big part of me that knows that I committed to this 12 months and there's a reason for it because I want more of that feeling that I used to get with it, like the look that I used to get. And I just keep thinking about, the end goal and why I'm doing it. Cause it just got to a point for me, it had been years of like every 3 to 4 months. And it could have been my perception of it, but it just didn't seem to be holding as well. It wasn't as long.
Yeah, it's hard to say. Again, true resistance is super rare, and complete resistance, like I've only seen that twice in my entire career. And I have some theories as to why those people may be experiencing it, but it's hard. I do, again, think there's perception drift. And also, sometimes I think it's we are aging, right, over the span of this. So, not only you are still aging, even though I'm giving you Botox. So, it's hard to identify whether that was resistance or just a kind of a perception drift type thing.
Well, for sure. For sure. I'm 42. I'm going to be 43 this year, and I'm hitting these perimenopause states. And I'm on social media a lot, and I want, there's a certain degree of wanting to look a certain way. I think for me, it's always going to be natural. I'm not a heavy makeup wearer. I don't have lip filler and cheek fillers, and I just don't want to look like that. I don't have lash extensions or anything. I just want natural enhancements. And that's what I loved about Botox is that like glowy, like dewy look that you get in your skin without even wearing makeup.
It is really pretty. I just feel so much better. There's some fun research about people feeling less depressed when they have it too. Because think about it, you can't frown. So there's like a biofeedback to that. If you can't frown, you're less likely to be unhappy. I feel happier. I mean, I feel like my lids are off my lash line and I can just take the whole world when I have mine done.
Oh yeah, it's like a fresh
Yeah,
spray tan. You're like, I'm
it's so
way
hot.
thinner. Life is good. Yes, exactly. No, and I think that's part of why it's so addictive. Like, I can guarantee, like, Botox is an addiction.
Yeah, you think so? Maybe.
Absolutely. Feeling good is an addiction. This is just one of the tools. For somebody like me, okay, so say I'm coming back in a year and I wanna do some Botox and some filler, and I mean, maybe I have a little bit of filler here, but other than that, like, what would you do on me? Like, how would you go about treating? Like, would it just be a conversation of, like, what my goals are or what you
Yeah, so what it looks like is you come in, I ask you guys a few medical questions, and then I ask what brought you in, and then I ask about your aesthetic history, what you've had done, what your goals are, what's bothering you. I think it's important for me to understand what brought you in because you can come in and I could tell you, from hairline, temples down to your décolleté, what I think you should do, but that's a little rude, right? And
Yeah.
also, I don't really, that's not my goal, although some people do those complete comprehensive treatment plans. So I like to understand what brought you in to see me. It also allows me to understand your guys' personalities a little more because you might have a patient that's a little more timid. I'm actually in those conversations, I'm looking at your guys' foreheads and how you express while you're talking to me so I can see your dominant side of your face. So it's not just like conversation, I'm trying to find out more about you. I'm also looking at your muscle activity, your asymmetries. I'm assessing what I think needs to be done as you animate because with animation I can see a lot of lines or things that I might not be able to fix, asymmetries that I might not be able to fix because of the way you animate or something.
And is that why, like, in the beginning when you have when you take your pictures and then you pick out where you're gonna inject, like, I know you always have me, like, furrow my brows and look down and, make all these silly faces?
Yeah, those pictures are hard. I think that's like its own sport and like the lights need to be absolutely perfect for us to get a really good idea. Those pictures basically are cover our ass. I look at them sometimes for some before and afters. or when I'm looking at a patient's progression, but really it's the way your muscles move, the way you animate, your skin integrity, how thick your fat pads are, your health, your body health. I'm assessing all that when you're sitting in front of me. That's the best way to assess those things.
So I want to ask you a little bit. You recently posted a photo of a mutual friend of ours, and I don't want to say her name because I don't want to put her on.
No, you can't. It's HIPAA.
Yes, yes, I don't want to violate anybody's HIPAA, but it's a certain person, and I want to know what you did to her face because when you look at the before and after, it wasn't obvious, but you knew something was different. She looked more youthful. Does that make sense? Do you know who I'm talking about?
I think I know who you're talking about. It's a multi-pronged approach for all of my patients. So again, I went in the mid face, the medial cheek. We have a deep fat pad that diminishes. I put some filler in there, and then also Sculptra. I mean, Sculptra's so great. Sculptra, I injected it deep on the periosteum, which is the bone. There's some emerging evidence about that helping to restore the bony areas. And then I think I went in the lateral cheek, the chin, the gonial angle. I mean, I just put Sculptra everywhere. And then a superficial Sculptra to help the skin integrity and tone. So that was like a full face makeover. Mm-hmm.
Why do you have to inject so deep? Like, what is that?
Well, I actually inject at different depths depending on what my goals are. So when I'm talking about periosteal deep injections, those are on the bone. That's why those are deep. So literally, I tap on the bone. I can feel the bone. That's how I anchor my needle or my cannula. And sometimes you do that in certain areas with filler because you don't want to disrupt lymphatics. You don't want to cause any kind of under eye bags or festoons or malar mounds or any of that strange swelling that you sometimes see under people's eyes. Or you don't want to worsen it because sometimes people, that's just a part of people's genetics. They have those. So different depths depending on where you are, where the lymphatic changes are, and then also your goals for the treatment. You have to understand the product in your hand too, which is, I go out and train on that all the time for Galderma, understanding the technology and the product in your hands. I mean, these are medications we're administering.
Talk to me about the product line. Talk to me about like your education and what you're educating people on, like how to use this specific product.
Yeah, so I am a trainer for the brand Galderma. I go out and train on Sculptra, the biostimulator we discussed, and the Restylane family of fillers. And so I really try to focus on technology and why I'm placing these certain fillers in certain planes and how I expect them to act in these planes and why I'm choosing that. So I really try to be evidence-based injector. I am an evidence-based injector. It's just not. If I'm sticking my needle somewhere, it's because there is some evidence that points towards some change that's happening, aging change that's happening, and I'm trying to, restore something in that area.
So, what would be like, so I know when I had filler, you used the cannula and you had to go deeper into the cheeks. Would it have been, which I did not tolerate very well.
Yep, it varies patient to patient.
It really surprised me because I'm not somebody who's fearful. I didn't overthink it. Like I didn't think I was nervous about it. I just didn't, but all of a sudden my body started reacting and my mind was like, "What? You're fine. Like relax. Like it's Danielle." But my was not into it.
That's called the vasovagal response. What happened to you? You also like you hadn't eaten and you just worked out, right?
Yes, I think I had
Yeah.
that day.
So I mean, you guys eat before you come to see me. Drink your water. It's hard though. I mean, you can't control that, and I'm trained for it, so never worry about that happening. So the cannula, some people prefer it and some people hate it. It's hard, but I can do both, so it doesn't matter. Like if the patient leaves it up to me, I prefer the needle. I just think I get better precision. But there's an argument for both, so I can see the benefit to using both.
Yeah, that's
Yeah.
gonna be in any treatment of any kind worldwide.
Right.
Gonna be
It's so interesting. I mean, do you see this too? Like you have so many different approaches. And I always tell people this is so important when you go out and train. This is just my approach. I'm not trying to like get on my soapbox and tell you I'm so right about this
Yeah.
technique that I'm about to teach you. Like this is approach. Take what you want. this is why I do it, and I present the evidence, and either you can do this or not.
Yeah, that's what I always say, take what you want and leave the rest. It is
Yeah.
what it is. And I agree with you on like it is just your approach. It's not the standard and everybody should do it like this. And I do think that's why a lot of people respect you within this community. Everybody knows who you are. And
Oh,
it's well known like that if they come to you, it's going to be you're going to get educated, you're not going to look overfilled.
you might get a little attitude. No, just kidding.
Well, considering your last name. No, I'm kidding. So why do you think I wanted to ask you, like, why do all the celebrities, and maybe this is like a facelift, but why does everything look whiter over the years? Like all of a sudden their lips look longer, but not vertical, like horizontal. Like why does everything look and why does they look fatter? Like their face looks more puffy.
I know what you're talking about. So we have our cheek width, right? Our bizygomatic width from here to here. And then we also have our bigonial width. That's our jawline. I think sometimes even celebrities, which is wild because they have all the money in the world, fall victim to that perception drift. So you're trying to fix something, you're trying to fix something. So you keep putting filler back here or back here, and eventually you widen people or you square them off, or you take the bigonial width more wide than the bizygomatic. That's very masculine, right?
Mm, it's kind of fattening up these pads back here.
Right. I mean, it's a bony prominence that I'm talking about back here. But yeah, you're widening somebody's jawline or you're squaring them off because you keep putting some filler right here. So I think that widening that you're talking about is sometimes just misadministered injectables. I also think that sometimes I don't think it's facelifts doing that because there's nothing. I mean, I'm not a surgeon, but there's nothing that I can think of that goes down in a facelift that would widen all those angles I'm talking about. I think it just could be mismanagement with fillers. I also think that there are some bony structural changes coming that happen that kind of make people look a little more squared off. But you do notice in celebrities it's a little more dramatic, and I think sometimes that's just the wrong interventions for that person.
Yeah, so could they could dissolve all of that essentially.
Yeah, you can dissolve that filler if that's what it is causing that. Yeah.
So how long does the Sculptra last? Like, what's the idea? Is that just preventative maintenance? You've piqued my
No,
curiosity.
it's restorative. So we're restoring collagen. So it lasts well past 2 years, but we can say on label it's studied up to 2 years. It's restoring your own collagen. It's going to be different for everyone, just like Botox and Dysport, how they metabolize it in their filler. But it's around 2 years.
Well, I've noticed too with the filler here, like it's been a lot this lasts very long on me.
Yeah, good for you. I'm actually surprised because sometimes my patients that work out a lot and are like on the leaner side, sometimes you guys burn things quicker. So I'm surprised. So good for you. You go, girlfriend.
Yeah, it has lasted a really long time. And my before and after photos that I have, I think are significant. I was like, "Oh my God." There was just such deep lines from a whole nother lifestyle ago, and so it has been wonderful having that because I just didn't wanna have wrinkles just being there, you know what I mean? Like, it's one thing if I'm smiling or whatever and there's wrinkles, but just sitting there, I just wasn't ready for the wrinkles,
And you
I
don't
think
have to. You don't have to have that.
yeah, I think I was in my early mid-30s, so it's been a while. It's been a while. Is there anything, like, new or exciting coming down the pipeline, like, in regards to injectables or something, exciting for you as an injector of what the future has to hold?
I think the future is biostimulators, and that's again stuff like Sculptra, Radius, things where it's called regenerative medicine, where you are creating your own collagen, right? I think that's what's exciting. That's not new, but I think it's emerging. People are becoming more knowledgeable about it and asking for it by name because they hear it on a podcast or see it online or something. So I think that's new. I always encourage people, I always want something that's studied. I always want something that's FDA approved. There is some stuff that I see online that piques my interest, but it's not studied. It's not FDA approved yet. There is some stuff coming down the pipeline from several of the large pharmaceutical companies that we can all be excited about because they go through that FDA process of getting these things approved. They're studied. We can't say things that haven't been proven to the board at the FDA. So I just love these well-studied products. But yeah, I think there's more fillers in the pipeline. I think there's a big biostimulator market in the pipeline. Yeah.
That sounds very intriguing. I really, really like that idea of that biostimulator. Tell me, I know there's a bunch of different Botox and there's a bunch of different fillers. Can you just go through like what it's for and why you're going to choose that? Or is it just a brand that you like, or how do you do that?
So if a patient defaults to me, I choose Dysport. Dysport has the high, depending on how you reconstitute it has the highest concentration of the active ingredient, which is responsible for relaxing the muscle. So, I found it was a journey. I found it to be consistent and reliable. And I think that it helped me grow my business and who I am as an injector because I was using something that I thought was consistent and reliable, people thought I was consistent and reliable, right? When really I think I was using a good product too. So I will always default to Dysport for those reasons. However, I'm super comfortable injecting all the FDA approved neuromodulators. I do inject quite a bit of Botox too, Botox brand. That's like the old faithful. I do leave it up to the patient because sometimes they do their own research or they have their own preferences, and I'm happy to inject whatever they want as long as it's FDA approved.
Yeah, you're good to go. What about fillers? Like, why would you choose this versus that? And what is fillers are for certain areas?
Yeah, so different technologies work differently. So there's some technologies that integrate into the tissues. So that might be really great in somebody who's expressive or it's in an expressive area where I need it to be dynamic and move with this person's mouth, right? And then there's some that stay in the bolus formation that I put it in, which can make it project more. It could stay in that spot. So it depends on the depth I'm at, right? So I'm choosing thickness and the flexibility in the projection of the filler. So I'm considering all those things. So when I'm looking at a patient and I'm feeling around your face, I'm pinching your fat pads, I'm pinching your skin. That's how I decide, like, how thick should the filler be for this patient, or what depth do I want to treat on this patient.
So somebody who wants more flexibility, like you were saying, what is the name of the filler and why, and explain why you would choose that one?
Well, all the pharmaceuticals have their own kind of line that will integrate into the tissues. I like expression technology because it really integrates into the tissues nicely.
These names of Botox and Juvéderm and all of that, those are just the brand names.
Those are the brand names, and then there's different that they all get their own trademarks for their technologies and stuff like that. Yeah.
Yeah, so it's like makeup. It's all foundation or concealer or whatever. It's just different companies that make it and call it something.
Different companies, yeah, in different technologies. Like they can't all be offering the same product, right? Because they have what's it called? Trademarks, I guess, on the technology. So it is all different technologies that you're working with, and they also draw like they're different hydrophilicity, so they'll draw a different amount of water to different areas. So you're just as an injector, if you're educated, you're considering all those things.
So where would you inject a more flexible one versus one you want to be more bulky?
So more flexible again would be dynamic area. So like around the mouth. Think about it like this is this lower half of our face. This is called the malar equator, this break from our cheek. We have that static cheek and then we start moving down here. So really like you want flexibility down here. You even want flexibility in the chin because you don't want it to look like you stuck an implant in your patient, right? So all these dynamic areas of the face. And then I might want something a little more thick, something that keeps its form a little more in the deep fat pads in the medial face, like in the periosteal injection, so I can actually get that projection and not lose product.
In the cheek.
Yeah.
Okay. And then do people like I've seen people getting like nose jobs with filler.
Woo! I don't do that crazy stuff.
Yeah.
No, it's not that crazy. I think it's fine. I would just go to maybe a plastic surgeon if you're going to go that route. I like to sleep at night. That's what I tell people. I like to sleep at night. There's risks. There's high risk areas of the face, and I do some of them, and there's some that I just won't fly, and the nose is one of them.
What's a high risk area in the face other than the nose?
The nose, the forehead. I mean, those areas I don't care to inject. I go up in the temples, I'll do the piriform. This is a little high risk. I think, down in the chin can be high risk. So I do go in very high. I go really medial in the cheek. So I do go in higher risk areas, but there's some areas that are just, out of my comfort zone.
What does high risk mean in your scope of practice?
So there's a risk with every procedure, right? You can start off with something like redness and swelling or bruising. Those are things every time you stick a needle in somebody's face that you need to consider. And then you can get to very devastating consequences like blindness. And so the cases of blindness come, from the nose or the glabella between the brows, most of them. So I don't do that.
Yeah. How do you feel about under eye filler?
I do under eye filler. I think it's very well studied. I think if you're in the right plane with the right product and also the right candidate, it has to be a really good patient, then it's fine. It's fine to do. But you have to be selective. You can't just do it for everyone who asks for it because a lot of people aren't good candidates for that.
And do you have the discussion with everybody about Sculptra? Are you like, hey, you should add this on? Or like, does it help evolve your filler or Botox? Does it enhance the outcome?
Yeah, I mean, you talk about loving the glow. Sculptra really provides a glow that's on label. They actually say that now. I think it's a really important part of a treatment plan. I don't like being pushy. Everyone needs Sculptra if you ask me. If you're coming to me for Dysport, you likely need Sculptra. We're losing 1% of our collagen a year, starting at the age of 20. So if I have a 45-year-old sitting in front of me, she's lost about a quarter of her collagen. And that's why you have the thin skin, the laxity, the shadows, the nasolabial folds, the marionette lines. You have, the sagging of skin along your jawline, so you obscure the jawline. So I think it's a really important global treatment. Yes, I don't discuss it with everyone. I just it's hard. It's hard. Like I never want to feel salesy. And it's a weird industry, right? Because I'm a healthcare provider, but it's also like a for-profit business. And you're like dancing this line. So I kind of wait for you guys to say something to me before I start making suggestions. But I mean, there's plenty of places you can go and they're going to tell you every single thing you can do from hairline down, sometimes in the hair to improve it.
Well, yeah, and they start with like monthly membership plans and like they're gonna do it that way, like a care plan.
There's all different ways to go about it. I don't actually knock that. I mean, those girls are genius business owners. Genius.
Well, there's a whole psychology to sales for sure.
Yeah, I'm not against that. It's just not my approach. I'm so casual about that, and it could also be because I'm not the business owner, right?
Yeah, no,
Yeah.
I get it. I have these wipes that I sell at work, and I always am like, they're only $10. It's like everybody can afford them, they're spending this much money on a service, but I'm like, I'm not trying to sell you on them, but like, here's the great benefit of using these after you get this service done. But I get what you mean because it's always this like,
Yeah. Well, I'm a nurse. Like I'm not a saleswoman.
Yeah.
So yeah, it just feels so weird sometimes.
Well, it kind of sounds like the Sculptra is like gonna be a game changer. That sounds exciting. I'm definitely
Well, it is a game changer.
yeah.
I mean, those who know. Those who are on the train are on it. They come back at 2 years and want that touch up. So I do think it's super exciting. I think it's important to say everything I do carries a risk. So it doesn't come without its risks, but I don't see a lot of, if any adverse reactions or responses. Knock on wood. One will show up tomorrow. But so it's pretty safe. Just some bruising comes with the procedure. Otherwise, yeah, people love it.
It sounds great. Well, Danielle, thank you so much for your time.
Thanks for having me. I can talk about this for hours. Can I come back?
Yes, let's come back and yeah, we can pull up some celebrity pictures and kind of rip them apart
That
or,
would be so funny. I try not to do that, but I have my thoughts on all the celebrities.
the do's and the don'ts, but I think we covered a lot of the do's and the don'ts and, your approach to it. And I think first and foremost, it's education and a natural approach. You don't want people leaving like, oh my gosh, what did I do? This was a mistake. I have to move now. Like that's not a good feeling.
No, no, no. Everything we do should be restorative. We're putting something back that you once had. And that's what's in fashion right now.
Well, and I don't think I've ever heard an injector say it quite like that. Like this is a restorative procedure or treatment, not, this is an aesthetic. Yeah, that's a good flip of the word. There's your sales right there. That's all you need.
Yeah, thank you.
Okay, thank you so much. Yes, we'll see if we can get together for a part 2.
Okay, that'd be so fun.